He's just a master at being able to make patients feel really comfortable from a standpoint of dental anesthetic, whether it's a local anesthetic or whether it's a IV sedation, and being able to get them through the procedures very comfortably so that they end up with a very painless, stress-free procedure. And that's hugely important to me. When I talk to my patients after they've come back from Dr. Bonine, they always tell me that they've had a good experience. There was no problems with pain, and they felt very comfortable, and they thanked me for referring them to him. Dr. Bonine sees all the things that are going on in a patient's mouth and wants to inform them so that they at least have had a chance to think about different options. They may not be options that they want to pursue, and that's fine. I think that's one of the things that makes Dr. Bonine unique, in that he does take a look at the patient, not just for a need to have a tooth removed or an implant placed, but he looks at their entire mouth. He's looking at the aesthetics of their smile and the function of their teeth, and he's looking out to try to do the best possible job and inform the patient as best as he can all the different aspects that could improve both their function and their aesthetics. I refer patients to Dr. Bonine because they have oral surgery needs. And then Dr. Bonine refers patients to me because those patients have come to him for oral surgery needs, but he also is aware of their orthodontic needs, and sometimes they're not aware of that. And so that ends up being really beneficial to the patient, because sometimes the patient will go and see Dr. Bonine to have a tooth removed or an implant placed, and Dr. Bonine will make us a couple of suggestions and show the patient a couple of things, and a lot of times that may stimulate the patient to decide that they'd like to get an orthodontic consultation. Some oral surgeons, when you go to them, they're just going to do the procedure. They'll take a tooth out, they'll put an implant in, but Dr. Bonine always has, he's always looked at the patient in the whole total oral health. And if he feels that there's some other things that the patient might want to consider, he brings it to their attention. And one of those things happens to be orthodontics. And so we've, over these last 25 years, we've had a nice team approach. If I have a patient that I need to have him expose a cuspid up in the mouth, someplace up in the upper part of the jaw, a lot of times he'll call me we'll do Facetime, and we'll be able to see, and he'll show me exactly where the tooth is and where he's placing the bracket, so that it helps me to understand better how I can bring that tooth in and what vector direction I need to do. It's very unique, and I think it is an unusual from a standpoint of, I work with other oral surgeons, but I've not really been able to utilize that technique.